Millions of Britons will spend Christmas under a strict lockdown following a government backflip on plans to relax the rules. Europe correspondent Nick Doll has more from London.
Boris Johnson says that a new strain of the coronavirus that had been previously identified is spreading faster than anticipated. So, for example, authorities say that this new variant accounts for around 50% of new infections in the London area. Now, it's quite normal, of course, for viruses to change, but the government says after analysing this new strain, they think it's up to 70% more transmissible. In other words, it's capable of spreading much faster. So even though just a few days ago, the Prime Minister Boris Johnson was saying that it would be inhuman to cancel Christmas and that it wasn't the government's job to be criminalising people's celebrations, that's exactly what he's doing. So as of tomorrow in London and in large parts of southeast England, a stay-at-home order will come into force. There will be no household mixing on Christmas Day and going forward into the new year. And importantly, non-essential shops will also have to close right in the middle of the pre-Christmas rush. So Boris Johnson was asked, how he could really justify this huge backflip in just the space of a few days. He says that the scientific advice changed, and so he changed his approach.
I know how much emotion people invest in this time of year and how important it is, for instance, for grandparents to see their grandchildren, for families to be together. So I know how disappointing this will be. But we have said throughout this pandemic that we must and we will be guided by the science.
All of the UK governments had planned to have a uniform relaxation of Christmas COVID-19 restrictions so that people could travel across the UK for about 5 days. They could have a Christmas bubble with up to 3 households. Now, that plan has now been dramatically scaled back in all the other areas of England that aren't covered by these new restrictions. So it will only apply on Christmas Day instead of 5 days, as was previously advertised. And that's going to apply in Wales and in Scotland as well. In fact, Scotland is going to be banning people from entering the country from other parts of the UK as well. Clearly, these relaxations were decided a few weeks ago when the situation was looking better, but it's clearly deteriorated. Just today, we reported another 27,000 cases. So the government says that, its approach has had to change as well. We've known for some time that cases have been trending upwards in the UK and that they've been growing in the southeast. The government has known for some time about this new variant of the virus as well. In fact, they announced that on Monday publicly. So all during that time, we've had public health experts, doctors and the opposition calling on the government to rethink the Christmas relaxation. But Boris Johnson continually said, no, Christmas will go ahead. Go and make your plans. Be sensible, but go and make your plans. And so I think a lot of people across the UK who haven't seen family and friends for months, if not most of the year, took some heart from the Prime Minister's reassurances and went and made those small plans for celebrations. And now they're being told with just a few days to go that, some of them will be spending Christmas alone. So despite the health merits, despite the clear need to clamp down further, I think today's news will be very difficult for some people to take.
Professor Callum Semple is a senior government clinical advisor and he explains the importance of the UK's reproduction number.
We have a virus strain that looks like it's been in our community for 4 to 6 weeks, possibly a bit longer. It is moving very quickly through the community. It's got a doubling period of about 7 days. And the R0, that's the reproduction number, is sitting at between about 1.6, 1.7, whereas the previous strain, which is still circulating, has got an R value of about 1.1 to 1.2 in the same community under the same conditions. And that's where this rather unhelpful 70% is coming from. That 70% is actually meaningless. The important thing is that this virus is a new strain and it's taking over the old strain. It's causing more sickness in a same period of time. And that's causing additional pressure on our healthcare system. There's no evidence at present that this virus in itself is causing more disease in individuals. It's just that it's moving so quickly and it's so transmissible that it's causing more disease in the community at large. As I said, there's no evidence of it having a different mortality rate. We won't know that for sure, probably for 4 weeks, because there's a delay between emergence of a virus and its effect on death rates. So we shouldn't speculate about that. And there's no reason why the mortality rate should go up purely because of this virus. It may just stay the same. The effect on the numbers of cases, though, is pretty obvious. There's going to be a rise in cases. The current vaccine is about 95% effective, which means it's really, really strong. Now, even if there's some conformational change on the spike protein, that's the key that the virus uses to unlock the cells and infect them. Even if there is some variation of that key, and we know there is, we'd still expect this vaccine to be pretty good. After all, 95% effectiveness is much better than we normally get for the influenza vaccine. So, and then there's other good news too. These new vaccines are effectively like emails that we send to the immune system, and they're editable. So what I think we'll have next year in the summer or the winter is a vaccine that might contain 2 or 3 flavors to cover the different variants.